Okay, this is Prevent and Reverse Hypertension by me, Pete Rogers. This is part number 12. We sort of left off talking about starch. You know, it's a polymer of glucose wrapped in fiber. Because it's so low caloric density, 1 calorie per gram, it stretches your stomach, providing early satisfaction of hunger. And then as it passes through your intestinal tract here, out the duodenum into the small bowel, it takes time for the digestive enzymes to peel the fiber apart from the glucose. So you get this slow absorption of glucose, having the effect of a slow release energy pill. And the net result is you satisfy your hunger with the lowest possible number of calories, so it makes you skinny in a good way, thin, slim, okay, if you prefer those words. And your blood glucose doesn't spike so high. You get a prolonged good blood glucose level. It's normal for it to come up a little bit in the beginning. That's normal. It's not like simple sugars where there's no fiber and then you rapidly spike your blood glucose, and the pancreas has a tendency to overcompensate and drive your sugar down, leading to rebound hypoglycemia, and then you chase more sugars and it ends up with a roller coaster blood glucose curve. Okay, you don't want that. Starches are just potatoes, rice, beans, quinoa, sweet potatoes, lentils, garbanzos, whole grains, okay? Dr. McDougall, all long-standing healthy populations eat a starch-based diet. There are no exceptions. C.S. Lewis said, spiritually, we are designed to run on Christ, in his book, Mere Christianity. Metabolically, we are designed to run on starch. Okay, here's some blood glucose curves, and you can see after you drink a sweet drink, just sweetened beverage with added sugars, spike your blood glucose, pancreas drives it down too fast, rebound hypoglycemia. If you eat the fat first, the fat causes insulin resistance, and then when you follow it by carbohydrate, you get a prolonged elevation of blood glucose. So eating is prandial, postprandial hyperglycemia. If you eat the starch, you get a little spike in your glucose, not so bad, and you stay relatively normal blood glucose a prolonged amount of time, prolonged satisfaction of hunger. This is the long-term satisfaction of hunger. The more fiber the food has, the better, more prolonged that's going to be. That's where you get that so-called second meal effect from beans with all the fiber, more prolonged satisfaction of hunger. By the way, I only eat the 1 meal a day diet, OMAD diet it's called, 1 meal a day, because it's convenient to eat after I come home from work at night. And I'm fine. Then in a sense, I get it like intermittent fasting, because I don't eat again until the next night. It works well for convenience. There's a downside to it because you drink the liquids at night and then you could, have to wake up an extra time at night to void, which I'm not thrilled about. I'm getting older now. I'm 62 years old and, I got a prostate. In a perfect world, like when I was a young guy, I sleep the whole night through. I wouldn't have to wake up to void. Let's see, what else? Well, that's pretty much how that works. I even do it on my days off, though, because I found I like it so much. I get so much done during the day by just pushing all my eating to night, like a Roman soldier. The Roman soldiers would be busy all day long, and then at night when it's dark they couldn't really do too much anyway, so they would just make a campfire and they eat a big dinner and go to bed. Okay, starches are the best food to satisfy your hunger. Here's an important paper. You probably want to hit the print screen button on this one and save this paper. This is a really important paper. Okay, it's from the Lancet Journal, 1929. Author's name is Donison. Okay, blood pressure in the African native. And these were adult men. Men were only examined, okay? And they admitted 1,800 consecutive patients, and not a single one of them had hypertension. Zero, none. They also checked the average blood pressure of men between the ages of 40 and 70, an average age of about 60, and the average blood pressure was 105 over 67. Whereas in the European counterparts, average blood pressure was 140 over 90. I mean, the typical white male from Europe was hypertensive. Okay, average male 60 years of age, whereas the typical black from Kenya eating a plant-based diet, even at 60 years of age, their average blood pressure was 105 over 67. And the relevance of this is that it was zero hypertensive. In USA, if you had admitted 1,800 blacks to a hospital, adult male blacks, probably about 80% of them would have been hypertensive. So what I'm trying to say is it's not genetics, that's all BS. That's an important thing to know. Okay. Let's see here. Richard Moore, he's the guy who wrote the great book, High Blood Pressure Solution. He said, hypertension is just a symptom of eating a low K-factor diet. Again, K-factor is the ratio of potassium to sodium. He said, nature gives us no choice. We must have enough potassium and magnesium for our cells to work properly, to run those sodium-potassium ATP pumps, and to thus maintain your electrochemical gradient across your plasma membranes. Okay? Anthropologists who study different cultures are unanimous that hypertension is due to diet and lifestyle, because populations eating their ancestral diets have almost zero hypertension. All the facts correlate to this. Vegetarians with high K factor, they almost never get hypertension. Animal studies show that increasing K factor lowers blood pressure, helps prevent strokes. Research on humans shows that improving K factor is much more effective for preventing strokes than is treatment with medications. I think medications have a tendency to overtreat hypertension, driving pressure down, which can cause strokes in and of itself. Clinical research on hypertensive treatment with drugs does not prevent most heart attacks and strokes. Biophysical research shows that every cell has an electrical system like a battery, the plasma membrane. That's the potassium sodium ATP pumps for normal homeostasis. It's how the cell does work across its plasma membrane. And if the sodium concentration inside a cell is persistently elevated due to a low K factor diet, then a whole group of predictable abnormalities occur. So this is what I mean by you can't get around it. Plant-based diet's the way to go. It's obvious. Our physiology is made for it. And then you get the same finding when you look at all the epidemiology populations. Whenever they eat traditional diets, especially plant-based, they're much better off. I would also say meat's better than processed food. Because the processed food, you're way high in sodium. It'll have an average K factor of less than 1 versus, the average K factor of meat's in the ballpark of around 4. So it's nowhere near as bad. And there's even the Simani population in South America, and they eat, some meat. They're eating probably about 70% carbohydrates, but they eat a little more meat, than one would certainly recommend in the USA. But because they're, getting average of like 1,600 steps a day, they're very active, and they're eating mostly carbohydrates, mostly plants, but they do eat some meat. They did well on their cardiac CT scans. So what I'm trying to say is meat in the wild is not anywhere near as bad as processed food, but I still wouldn't eat it because the average American, they've already hit middle age, previously eaten, standard American diet or the Mediterranean diet or something like that, and they've already got a lot of baseline atherosclerosis and other problems, and they need to detoxify and turn things around fast. They're not in the process of preventing disease. They should be attempting to reverse disease. They're already far down the line. Anyways, hope that was helpful.